After an augmentation mastopexy or breast lift with implants, you can shower after 48 hours. You can exercise in a supportive bra after 1 week, as long as you don't do any exercise that involves bouncing. So if you really want to exercise, you can do so after 1 week, but like I'm talking ride a stationary bike or some type of cardio that doesn't involve bouncing and that doesn't involve a whole lot of upper body or arm movement. You can go swimming and go underwater after 3 weeks, assuming that everything is healed up okay. I want you to wear a supportive bra to support the weight of the implant off of your soft tissues that are trying to heal around the implant for 2 months. So I want you to wear a supportive bra day and night as much as you can for 2 months. Of course, you can take it off when you shower, and you can cheat every now and then if you're going out and you want to wear a cute dress or something like that. But for the most part, I want you to wear a supportive bra for those first 2 months while all your tissues are healing around those implants. As far as the scar care or the incision care goes, I'm going to put Steri-Strips on your incisions initially. Once those start to fall off, I want you to use paper tape, and the paper tape will give you a roll of paper tape. Basically, whenever the Steri-Strips fall off, you put paper tape on the incision. I have you do that until you hit the 6-week mark after surgery. At that point in time, when you're in clinic, I will laser your scars, and that is about everything we can do to help your scars look as good as possible. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.